When you choose who should do your joint replacement, there are two things you should look at. Number one is your surgeon and his expertise, and number two, the environment you're going to be treated in, i.e. the hospital. In terms of a surgeon, there are some basic principles. Firstly, it is widely recognized these days that the more one specializes in one part of the body, the better they're likely to be. A certain minimum volume of procedures is very important, because otherwise you can't call yourself an expert. And in the UK, we have the National Joint Registry, which tells us how many of a procedure somebody does and what their long-term 20-year outcome data is. And you must feel free to ask your surgeon for this data. Generally, if somebody is doing a reasonably high volume of surgery and the outcome data is good, they are likely to be a good surgeon and will be able to look after you reasonably well. My own data on the National Joint Registry demonstrates that we have amongst the lowest revision rate in the United Kingdom over the last 15 to 20 years. And my experience is of over 8,000 knee replacements. Every year I do approximately 600 knee replacements a year, made up of partial knee replacements and full resurfacings. And we monitor the patients very carefully and collect data so we know that these implants are functioning well over the years. The second aspect of this is to make sure that the hospital environment you're being treated in has the facility to look after you not only in what is predictable, but also what is unpredictable. And most patients don't look into this before they choose their hospital environment. For instance, the need for a high dependency unit or an intensive care unit is rare, but if you do need it, the hospital may not be able to provide it. We are lucky here at the Cleveland Clinic London, where we have a world-class facility with a floor of intensive care and multidisciplinary specialists, be that intensive care consultants, consultant physicians, cardiologists, renal physicians, and many other specialties supporting our patients. So in the rare instance where you need additional support, you are in the best place to receive this care.